All right, so welcome to the practice. I want to show you how we're going to use a low-level light therapy. This is a device that you're going to get. It's going to come in a box like this. Very simple. We open it up. Inside there's an instruction manual. We're going to give you instructions in this video and written instructions, so you can read through this if you like, but please just disregard it, except for any warnings. So here's your power supply. It comes wrapped up. You've got a power supply that's going to plug into any 110 outlet, and on the other side here we have a male end that will go right into this part of the power supply. Just plug it in like that, and then of course this will plug into the outlet, which we're going to do in a second, and we're going to unbox this, unwrap it. So on this one, there again is a male end, a little different shape. You're going to take it into the device that has the LEDs. You're going to just slide that right out of the package. And it plugs in here, and then it screws on, kind of like you screw in a TV cable to a TV. Just like that. Now, I'm already prepared. I've got my shoes off. I'm going to show you how to use this. Let me go ahead and get it plugged in. All right, so the great thing about this device is it has a really long cord, and it's pretty hard to mess up from a treatment standpoint. It has a red light, and when you push that red button, the red light comes on. That's your red light and your near infrared LEDs. This will run for 1 minute once you push the button. So once you push a button, just let it go until it stops. So different areas we're going to treat. We're going to treat the foot. So we'll start on the left foot. We'll hit the button, and we're going to hold that just basically right at the surface of the skin. If you feel it gets too hot, go ahead and take it out a little bit. You're going to hold it right at the surface of the skin. We're going to treat the bottom of the foot for 1 minute. Once that 1 minute's done, your machine will stop glowing. And then we're going to come to the back of the leg and the calf area. Hit the red button, same thing, right there for 1 minute. So you do that on the left side and the right side. If you're doing your hands, you would go ahead and do a minute on the left hand and a minute on the right hand. And for anybody who's treating the feet, unless you've got hardware in your low back that we've talked about, we're going to treat an additional area right here in the small of the back. Of course, this needs to be skin on skin, so you wouldn't treat it through the clothes. That is the near infrared LZR device.
Hey guys, I'm here to show you how to set up your rebuilder. So when you open the packet, it's going to come with some instructions. You'll also have a little yellow bag. So this is your rebuilder unit. It also comes with a set of leads. And what you're going to do, you'll open your leads, and they plug in right on top of the rebuilder unit. The big thing is that this little silver circle on the leads has to go towards the front. Just like this. From there, you are going to take your yellow bag, and inside of it you have 2 rubber leads. And they will plug onto the end of your rebuilder leads. There is a tiny hole right on this lip. There's a ledge, and that is what it goes right up against. And you twist and slide it in. And then you have your rebuilder set up. Hey guys, I'm going to show you how to set up your rebuilder treatment at home. So the first thing you're going to do is you have your rebuilder bucket. There is a little ledge in here. I want you to fill up the bucket with warm water about to that ledge or to where your feet are submerged. Once you have your bucket of water, you will take your electrolyte solution and you're going to spray on top of the water 5 times on each side. From there, your bucket's ready to be used. So you're gonna place both your feet in the bucket. Both feet have to be in the bucket for the machine to work properly. You'll take your rebuilder unit and you will drop one rubber lead on each side of the bucket. They don't have to touch your feet, they just have to be in the water. At this point, you can go ahead and start to turn your rebuilder on. Turn it up to where you can feel it. I don't want you to be in any pain or discomfort, but I do want you to feel the sensation. The machine will run for 30 minutes, and once it's done, it'll shut off on its own. Just be sure to click it back to off so that you don't drain your battery.
With your conductor gloves, once a week you want to rinse these out. So everyone usually has a sprayer over by their kitchen sink. You're going to disconnect the lead. And you're just going to rinse this with some warm water, not hot water, just warm water. Just spray it down. You'll see maybe like a residue come off. That is from the conductor spray because this is salt based. And what you want to do is you can just kind of go down and glide so you get some of the water off, but you never want to wring these out. You never want to put these in the washer machine either. There's wires in here, so you don't want to damage those. Once you've rinsed these out, just let them lay and dry. About once a week you want to do that. Make sure with the unit, you never get the unit wet. It's very important that this unit never gets wet. Of course, your pads and your gloves will have the water, but make sure this always stays dry. We're going to explain how to do upper and lower with the rebuilder and then with the LZR. So you're going to put these rubber pads, hook it up to the connection here, make sure the pin's all the way in. You're going to put lukewarm water in your bucket until it's right above that lip. You're going to put 5 squirts of the conductor spray, the rebuilder electrolyte spray, on each side. Once you put your feet in the bucket, you're going to put 1 pad on each side. Make sure that it's in the water. Your feet don't have to be touching them. And then you're going to get your gloves. So this is going to be your conductor gloves for your hands. And what you're going to do first is you're going to get just a regular water bottle and spray the inside just to make it a little damp and on the outside. And then you're going to connect the other lead to the glove itself. So there'll be a little black piece here. You're going to slide that in again. And sometimes you have to twist it around a little bit. So once you spray with water, you'll use that conductor spray, like I said, to spray the inside, the outside, just to make them damp. You're going to put your hands in. Sorry, you getting there? And then you're going to turn the unit on. So you'll turn one side on, it'll be for your feet, and the other side will be for your hands. You never want to go past a 5. Even if you're not feeling it, it's still working and still sending that signal from your brain to the nerves. So you want to just set that on 5. Your hands might not need as much. You can always make that a little lower. And you're going to run that for the first 2 weeks. It'll be for 15 minutes. And then after that, it'll be for 30 minutes, 2 times a day. Once you're done with that morning session, you'll want to just lay these out on a towel and then lay your pads out on a towel just so they dry out and dump that water out. Make sure you turn the unit off each time you use it so it'll save your battery, and then it'll reset. Now for your LZR, which is your infrared light. So this is your infrared light, your LZR. You're going to be using this also on your hands and your feet. So really important, once you get everything hooked up, there's a little red button underneath here, and this is how you're going to turn the unit on. So you're going to use this for the first 2 weeks, 30 seconds for each area. So you'll turn this on, make sure it's not right in your face, hold it down. You're going to hold this on the bottom of your foot. You just have to count for 30 seconds. Then you put it to the back of your leg, make sure it's right on the skin, not over your pants. Then you're going to put it on the bottom of the other foot, back of the other leg, so it's up by the calf. And then you're going to put this on your lower back. So that'll be 5 spots for the lower half. It's really important with this unit, there is a little fan here that cools the unit, that it's never closed up, that you're not putting your leg on top of it. So if you can't bring your leg up like this, maybe someone can help you. Or you can try to prop it up against something just temporarily. But make sure that that unit, that fan, is always open. It will shut off after 1 minute by itself, so you'll have to restart it once you go to 1 minute for each parts, which will be 7 areas. You'll use this twice a day. Make sure this also does not get wet. It's very sensitive, and you don't put any pressure on the plate.
Hi guys, I'm going to show you how to use your nerve plate. You should have received it in the mail by now. When you open it up, you will just plug it right into a wall outlet. From there, you can turn it on with the switch on the back. It'll light up red. And then what you're going to do is rest your feet on top of it. Wait about 30 seconds and it will go ahead and turn on. You'll feel it. We want you to do this at least 3 to 5 times a week for approximately 10 minutes.
All right, so now it's time to learn how to use your Neuropathy Premium Nutrition Support Kit. So it comes in a nice little box like this, and you're going to open it up. First thing that you're going to notice is there is a guidebook in here. The guidebook is going to tell you exactly how to take each one of these nutrients and what those nutrients are actually being prescribed for. So if you look in the guidebook here on this page 6 and page 7, it's going to list those nutrients and how to use them. Also in the guidebook, page 9, 10, 11, and 12 are going to talk to you about what type of nutrients that you put in your body that can help you recover faster and get your body healing better, and what type of nutrients can actually be negative and slow down the recovery. So pay attention to this. Everything you need is in this guidebook. If you're a person that likes to do things by paper, there is a daily checklist that will tell you exactly what you need to do when you check this off. Otherwise, we'll be keeping track of this electronically. So on to the products. This one right here, this says VasoPro Plus. This is a pink powder. There's a scooper in here. You'll take 1 scoop of this twice per day. This one, these are neuroprotective greens. It's the greensberry drink. There is a scoop of this. The scooper sizes are different. You'll do 1 scoop of this twice per day. Most people will take cold water or juice. If you're diabetic, make sure it's a juice that's sweetened with stevia. If you're going to do a low sugar juice, you'll take 1 scoop of this, 1 scoop of this, and you can mix that together and drink that. And you'll do that again twice per day. A lot of patients prefer the taste of it if it's been refrigerated. So if I'm taking this in the evening, I've already made that after I took my morning dose. It's sat in the refrigerator, so it's nice and cold. Next thing here you have is Inflamex. Inflamex helps to reduce inflammation. This is a homeopathic extract. You're going to take 2 dropperfuls, not the whole pipette, but 2 squeezed bulbfuls. 1, 2. You're going to take 2 droppers full of this in your mouth. If you want to do it under the tongue, you can. If you want to put it right in the same drink that you make, go ahead and do that. But I need 2 dropperfuls of this done, the Inflamex, twice per day. Last but certainly not least, there is a topical here called NeuroSoothe. This is going to contain a little bit of menthol, can help to calm down some of those aggravated nerves, but it is a topical vasodilator with arginine, so it's going to help to open up those blood vessels, get oxygen and nutrients down to those nerves when they're aggravated. So a little bit of this goes a long way. A pea-sized drop once or twice per day can really make a difference, especially, if you have trouble sleeping at night, you'd want to do that right before you went to bed, or if your neuropathy wakes you up at night, have this by the bed. Word of advice on this, because it has menthol, you want to make sure you wash your hands before you touch your eyes, use the bathroom, or anything like that. Folks, that is the Neuropathy Nutrition Support Kit. Easy peasy.
Hi, I'm Taylor. I'm the health coach here at Aligned Health and Wellness. As you begin your peripheral neuropathy program, I want you to know that you're not doing this alone. I'll be checking in on you every 2 weeks for your coaching calls. These calls are a chance for us to connect, talk about how you're feeling, and make sure that you're comfortable and confident with your treatments and supplements. We will also go over dietary recommendations and talk through what to expect as your body begins to heal. If you ever have questions, concerns, or run into any challenges along the way, That's exactly what these calls are for. My role is to support you, help keep you on track, and make this process as smooth and successful as possible. I'm here to help you get the most out of your care every step of the way. I look forward to working with you and being a part of your healing journey.